Good morning, everyone, and welcome. We are going to go ahead and get started. It is just after the 9 o'clock hour. We want to welcome you to our February Regional Healthy Northeast Ohio convening. We are so pleased to be joined by all of you, and we have a packed agenda, so we are going to move right into our content today. But once again, thank you so much for joining us. A reminder to please keep your lines muted. We invite you to participate either camera on or camera off, but it's great to see so many familiar faces this morning. And we also will be sharing out the event recording later after it becomes available for this meeting. So if anybody on your team is unable to participate or you would like for them to receive the information today, please do feel free to send that out as well. We are going to go ahead and start off with some brief introductions. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio, and I'm based at the Center for Health Affairs in Cleveland. And I am one of 2 local site administrators for healthyneo.org. And I'd like to invite my Healthy Northeast Ohio counterpart to go ahead and introduce herself.
Good morning, everyone. My name is Sarah Zabo. I work at the Cuyahoga County Board of Health as a data analyst, and I am the other local site administrator for Healthy Northeast Ohio. So welcome. Thanks for joining us.
Thanks, Sarah. And I know many of you have already done so, but if you could be so kind as to add your name and organization to the chat so we know a little bit about who is joining us today, that would be great. We would like to take just a few minutes to cover our agenda for this morning. So we are going to be providing a couple of brief updates. We have some CHNA and community health improvement planning updates from all of you, or from many of you. And we also have a guest speaker. We have Ashley Wendt from Conduit and Healthy Communities joining us. And then we will wrap up with our meeting conclusion today as well. So before we do so, I would like to stop sharing. We did this at the last regional convening, and it was a fun way just to see that representation of who all was joining, since we do represent 9 counties across Northeast Ohio. So we are going to do a brief roll call for all of our 9 counties. And again, if your camera on, feel free to just wave, or if you are camera off, you could also use the raise hand function through Teams. But we are going to go through that list of all of our counties, and if you'd be so kind as to call out who you're with, that would be great. And I know many of you also have a multi-county service region that you cover as well. So feel free to chime in for whatever county or counties that you represent. So we'll start off with Ashland County. I know we've got Vicki. Good morning.
Good morning. Yes, Vicki Taylor from Ashland County Health Department. I'm happy to be here.
Hi, Vicki. Welcome. Great to see you. Ashtabula County. And I think I did see, yep, we've got Tina.
Good morning, everyone.
Hi, Tina. Hi, Jennifer. Great to see you. Welcome. We've
Ashland
also
or Ashtabula?
Ashtabula.
Jennifer Cleveland, Ashtabula County. Good to see y'all.
Thanks so much, Jen. We also have Cuyahoga, and I know we might have quite a few Cuyahoga County representatives on. So good morning. I see Renee. Hi, Renee. We've got Martina Pace. Good morning. Christy, Meredith. Great to see all of you.
Hi, Lachelle Pugh we're based in Cuyahoga, but we work across 23. So you're going to mention most of them. I just figured I'd pop up now.
Thank you so much. Welcome, welcome. We also have Geauga County on today, and I know we had a couple of Geauga County partners. Hi, Magali.
Yeah, hi, I'm Magali Rios with Geauga County Health.
Welcome, welcome. And Lake County.
Hi, good morning, Jessica Wakely.
Hi, Jessica, welcome.
Thanks.
We also have Lorain County. I know we have Andrea, who it looks like, Andrea, you're on. Good morning, how are you?
That's me. Good morning.
Andrea, and then, oh, Catherine's here too. Hi, Catherine, welcome.
Hi, everyone. Catherine Mercy Health, thank you.
Great, great. And then do we have anybody from Medina County on? I know Kristen was potentially joining us. Good morning. Anybody from Medina? And we can go right into Portage County. We have any Portage County representation today? And then we'll wrap up with Summit County. And I think I saw David is on.
Yep. Hi, David McCartney, Summit County Public Health.
Great. Hi, David. Welcome. Well, thank you so much, everybody. We're so glad to have you all joining. And again, thank you for entertaining our roll call. It's always just great to see who's in the audience and who is participating in our events. So we appreciate your attendance and your support. We will go ahead and move right along. I already mentioned what we will be discussing through our agenda today. I know many of you are already familiar with us. We have provided some background information here, and if you joined a little early, you might have seen these on our loop slides as well. So again, we continue to be really pleased to be able to work in our service region, and we do continue to be funded by the Health Comp Foundation and also through partner contributions. As many of you might have participated in for one of our previous regional convenings, we did define a regional convening purpose. And here you can see that our purpose of these convenings is to convene partners across the 9-county Healthy Northeast Ohio region to drive community health improvement through collective impact. So thank you again to everybody who participated in defining that. And we are going to move right into some of our Healthy Northeast Ohio site updates and enhancements. So the first one that I will mention, our website's how to use this site page, which some of you may be familiar with. It does continue to feature information about how to get involved in our efforts. We have some how-to documents, video tutorials, but we did recently add a new tool called Utilizing Healthy Northeast Ohio for grant proposals. And this outlines how Healthy Northeast Ohio can be used by both grantees and grant-making entities to support both grant applications and even reporting processes. So this again is something that is on our resource library. It's on that how to use this site page, but we're very excited to be featuring that now. And we also wanted to provide a brief update about the Food Insecurity Index, which is available on healthyneo.org. And a reminder, this is part of a 3 indices toolkit. It's the Socio Needs Index Suite that's available through Conduent HCI, our website vendor. And it is a measure of food accessibility that's correlated with economic and household hardship. It was actually released back in early 2021, but we wanted to just provide all of you with the update that it was recently updated for 2022. And again, this can be used to identify areas at highest risk for experiencing food insecurity down to both zip code and census tract levels. So we do encourage you to view that at your leisure. And Sarah, I'm going to go ahead and turn it over to you for our last 2 Healthy Northeast Ohio updates.
Thanks, Libby. And I think next slide, please. Perfect. So I know we may have shared these in the past, but we wanted to remind everyone that we do have a success stories section on our About Us page. And, our hope with this really is just to share examples of how you all may be using the website in your work. And not that you can read these, but we currently have 4 success stories that we've created in collaboration with partners. And for those partners who've collaborated with us, a big thank you. But we are currently interested to hear from any of you who may have used the website for either a grant application or maybe even a grant report, as well as any partners who may be working with students. We have heard rumblings of public health students, like undergrad or graduate students, using the platform. So if you're aware of any of these examples or you've used it in another way and you're interested in collaborating with us, I would just encourage you to either email Libby and I, or you can also use the Contact Us page on our website. The next slide, Libby. Thank you. And we also may have mentioned this in the past, but just a quick refresher, we wanted to bring up that the Healthy Northeast Ohio website does have the option to create progress trackers. And this is a tool that can be used to visualize progress related to priority areas or goals from community health improvement plans or implementation strategies. So what you're seeing here is just a quick mock-up we made of what this could look like. So we were envisioning, if all of our counties were interested in creating a progress tracker, we could have a landing page like this, where a user could come and click on one of the county buttons to be taken to a county-specific progress tracker, which I think is shown on the next slide, Libby. Thank you. So at the top left, again, this is just a mock-up of what this could look like. But I think here we're just showing a mock-up of what a Geauga County progress tracker could look like. And these progress trackers allow you to add things like checklists, graphs, and then also custom content, maybe like text or images, again, to just track that progress. And you can see in the bottom right, I kind of just showed what it would look like if you clicked on one of those items. So the top is a checklist where it can show the status of an objective. And then the bottom item is a graph. So you can track data that is actually not on the website. So more programmatic data, enrollment numbers, things like that. So again, we just wanted to make sure that everyone is aware of that. We know the timing might be better now. We've brought it up in the past, but it was kind of off cycle. So as partners are working on their CHNA and CHIPs, if there's interest, please reach out to us. Thanks, Libby.
Thank you, Sarah. And we are going to move into our partner update section of our agenda. I know I had the opportunity to touch base with many of you prior, and we do have some regional partner updates in response to respective community health needs assessment or community health assessment work, community health improvement planning or implementation strategies. So we realize everybody is not necessarily on the same cycle. Everybody might be at varying levels of this process, but we know that several of you have completed the assessment piece, and as you finalize that and begin to transition into that health improvement work, we did want to feature some key highlights for all of our regional counties. So we do have some slides outlined with some rough highlights for many of our counties here today, and we will move right through these. So I'll go ahead and display these, and we'll call up our partners as we go through them. So going alphabetically, up first we have Vicki Taylor from Ashland County. So Vicki, take it away. I know you had a couple of items you wanted to share with us.
Yes, thank you so much. I don't know how we could have gotten through the process this time without having the data from Healthy Northeast Ohio. It helped us to visualize the areas in which we need to focus for our CHA and CHIP. So our CHA priorities were cancer, access to care, mental health, substance use, and misuse. And this came from both primary and secondary data. Our secondary data came from mostly all the information on Healthy Northeast Ohio. And then our primary data were focus groups and talking with key leaders in our organization. So one of the important areas for us was a death rate due to drug poisoning. We saw that our trend had been going up, went down a little bit, but as you can see is really climbing up again. These are the tools that we use to kind of notice that this was one area that was substance use and misuse. You guys see the next slide?
I think this is the only, this is just our only slide. Yep.
Okay. Yeah. So this just goes to show how we can just use this data and visualize the areas in which we need to focus. Another one that was surprising for us was our colorectal cancer rate. And by using the same similar type picture, you could see our charts were just, just off the chart compared to other Ohio counties and US counties. And it's similar information, just like these pictures right here. So we just found this to be very helpful, very useful, very visual, that we could put this information immediately into our CHA and our CHIP, and to show this to our community partners. So
great. Thank you so much, Vicki. Appreciate the update for Ashland County, and we're excited to see that report. And next up, we should have, oops, I'm having a little bit of a technical issue, so I'm going to go ahead and stop sharing for just a moment. But next up, we do have Cuyahoga County. So Renee, if you would like to come off of mute and share, I'm going to attempt to reshare.
Okay. Thank you, everybody. Excuse me, my dog loves joining in on Zoom calls, so I already apologize. My name is Renee Rafali. I work at the Cuyahoga County Board of Health. Right now, we are really in the thick of it with our CHNA CHIP process. So our CHNA was actually published in December. It can be found on our website, as well as various other websites, Healthy NEO website. And the process that we used for our CHNA was a secondary data collection, obviously using Healthy NEO. We then focus on gathering community input. This was essential to the process. with the help of Conduit, who Ashley Wendt from Conduit will be speaking later. We conducted 3 community focus groups and 32 key informant interviews, which helped influence our development of our 3 priority areas, which, as you can see here, are behavioral health, which includes mental health and drug use, misuse, accessible and affordable healthcare, and community conditions, which we've broken up into access to healthy food and community safety. We are just, wrapping up our CHIP report development, which should be finalized here shortly and for release. And our next step that we're really focusing on is building out our implementation phase, which, as you know, is when the bulk of the work actually gets done. We are developing 4 cross-sector working groups. Those are being built out currently, with these 3 priorities listed here, as well as eliminating structural racism. And groups will include members of the collaborative as well as those with lived experiences. So we're sort of in that step right now as we wrap up the report of getting this implementation phase kicked off and going so we can actually do the work as a community. Thank you.
Thanks so much, Renee. And next up, we are going to be hearing from Magali Rios from Geauga County.
Yeah, I'm Magali Rios. I'm one of the health educators here at Geauga Public Health. We completed our CHNA in January, and we are hoping to present and publish the results in early March. We are currently finalizing the CHIP report, so we're excited to share that obviously in March or April. And for the next steps, we are just going to be following up and meeting with the health priority groups to start on the first year. So we're excited. We're really excited to share the findings and everything with our community. So thank you.
Thanks so much, Magali. Appreciate that update for Geauga County. Next up, we are going to have Jessica Wakely from Lake County.
Hi, good morning. So Lake County is just about a year out now from when we conducted our community health needs assessment. We started that very tail end of 2021 and into early 2022. It consisted of a secondary data collection where we collected about 180 data points that we compared to Healthy People 2030, if it was applicable, national, state, and 2 demographically similar counties. I guess just a side note, we did that very manually ourselves and are very much looking forward next time to being able to make better use of this platform to assist us in that process. We also did a community resident survey, 5 community focus groups, and a community leader survey all last spring, and then worked with Conduit to do our data analysis. And kind of as we went through all of the findings, we had 9 areas of concern that we got together last May with our partners and prioritized down into the 3 you see on the screen here. So access to healthcare, behavioral health, and mental health and substance use and misuse, and chronic disease. And then last fall, we got together with our partners. We do have a fully drafted CHIP in place. It has been approved by our board here at the health department and is currently waiting on a vote with University Hospitals Board, which we anticipate will happen in March. And we have a couple of strategies that have started to kind of take off, even though we're still awaiting approval with some of our partners. 2 of those main ones being some storybook trails that we're going to be doing with that some of our partners will be doing with the Lake Metro Parks, and that our health department will be trying to focus on municipal parks, and some stuff with mobile food pantry here in the county, and as well as several others that have are in various phases, I guess, of getting kicked off or already in progress. So we're looking forward to really getting rolling and having everything approved and ready to go here. So
that's great. Thanks so much, Jessica.
Thanks.
And next we are going to move into Lorain County, and I believe we are going to be hearing from Andrea Ferguson.
Yes, good morning, everyone. So in Lorain County, we just released our community health improvement plan in January, and we have 5 priority areas, which on the screen: cancer, chronic disease, maternal child health, mental health, and substance use. And some other things that we mention in the CHIP that we know we're going to have to work on across these priority areas are internet access and workforce vitality. So when we did our community health assessment, we also did a lot of focus groups, and those were two things that came up very consistently across partner groups, and they aren't just about cancer or just about substance use. They kind of touch every aspect of health. And so far, we're doing this chip cycle a little differently. So I wasn't involved in previous chip cycles but from what I understand, the chip priority subcommittees would come up with strategies and tactics and try to work on them themselves. But this cycle, we're taking more of a bottom-up approach. So we chose strategies based on what our strong partner groups are already doing for health. And then we prioritized which of those strategies would fit into the chip based on a rubric that's in our appendix in the chip if you want to check it out. But almost all of the strategies are already happening, which is great. But we do, that does mean we have a lot of new partners at the table. So what we've done so far is we've oriented all of those CHIP steering committee and subcommittee members for this cycle. And then each committee is going to start meeting and looking at the data in the months that come. And that's where we think it'll be a little different this cycle, where instead of spending meeting time doing planning and strategizing, the meetings will be more about looking at data and figuring out whether or not these strategies are actually working, and if not, how to make them better.
That's great. Thank you so much, Andrea.
You're welcome.
And next for Summit County, we are going to be hearing from David McCartney. So David, we invite you up.
Sure. So we completed our CHA back in December, I want to say. And now we are also moving towards our CHIP process as well. From the CHA and the previous CHIP, we are probably going to be sticking with the same priorities moving forward for the CHIP from the last time. And so those were adolescent health, maternal health, child addiction and mental health, chronic disease, and aging populations. But we've also realized through the CHA data that we need to have an increased focus on issues such as racism, LGBTQ status, and health needs, and other social determinants of health. So for example, in our CHA, we found that violence increased, but that also comes with the caveat of the agency that we're using for that data. A lot more of other police reporting agencies are putting their data into that same system. So is it an actual increase, or are we just seeing that increase tick up because of the number of people who are now reporting into it? So keep that in mind when looking at our CHA. COVID became a top 5 death, as I'm sure it came across everybody's screen. But in 2 years, we saw that it impacted communities 35 plus, age 35 plus, and it became a top 5 risk factor of death in those categories. And then also, while some health issues did stabilize across the board, we saw that the racial disparities within those categories getting worse. So for example, deaths of despair, while those numbers have relatively stayed the same throughout our county since the previous CHA, we saw that the Black and African American men population had a huge increase in those deaths of despair, but that rate overall for the county stayed relatively the same. So there's work that needs to be done there, addressing those issues on a racial basis. Currently with our CHIP, we have sent a survey out to a lot of our community partners and leaders in the community to get their input as to what their needs and priorities are, as well as what they're already working on. So with that, in regard to all of the factors in the CHIP that we've focused on, so we had 14 main priority sections that we looked at. And then from that, we are assigning points based off of the top 5 that we're focusing on from the previous CHIP, and seeing what they are doing as well already. So that way we're not double dipping, we're not duplicating efforts, and we can kind of build off of what everybody is doing and seeing what is working for some organizations that other organizations can then implement across the board and move forward to increase health outcomes across the county.
Thank you so much, David. Appreciate the update for Summit County. And I know we have a couple other individuals who we'd like to hear from. And so I will just call you up if you're here. And I think I saw Elizabeth Fiordalis from Cleveland Clinic. I think I saw that you're on. If you are interested and able to provide a brief update for the Cleveland Clinic, that would be great.
Thank you, Libby. I apologize for my tardiness. Yes, would love to give an update on what the Cleveland Clinic Community Health Needs Assessments and now the implementation strategy projects are doing. We have completed the first part, the CHNA of the process. We completed 20 reports with both our Cleveland Clinic facilities, and also we are working with Select Medical, and we do our rehabilitation and our long-term care facilities. So it's a continuum of care of our hospital services. And in our Cleveland Clinic facilities and our Cleveland Clinic hospitals, and these are just our Ohio hospitals because we're all in the same time frame, right? Our Florida hospitals, we put them last year, so it's nice to have a consistent group of folks. Our Cleveland Clinic hospitals have completed the CHNAs, and our top needs are access to affordable health care, behavioral health, which includes both our mental health, also the substance use disorder, both of those topics in there, chronic disease prevention and management. Our fourth is maternal and child health, which includes the infant and maternal mortality. And the fifth bucket is our social economic issues, which is not a whole bucket of social determinants of health, but it's a select applications within that category. We also have added as community themes, making sure that we address these and put them front and center, that we have a look and an expectation that each category addresses and provides some strategies around health equity. Also the social determinants of health, and it's so great to hear that everybody else is saying the same thing. Everything from structural racism to poverty to education to levels of income, rental access. So that's all terrific, and we want to make sure that we apply that in every perspective we have. And we also have in there for our clinic hospitals focus on medical research, and trying to find cures and disease modalities, as well as professional education. So we've added those as additional themes to our CHNA. Our rehab hospitals and our long-term care facilities are looking at access to affordable health care, adult health, looking at those populations above 18, and also community safety, specifically around food security and a look at falls and accidents. Our next phase is the implementation strategy phase, and we're working with all the hospitals to create those next action steps, the ones that are top of mind, especially for our Cleveland Clinic hospitals in Cuyahoga County, are lead poisoning for youth and families, maternal and child infant issues, and then also food insecurity, specifically around children. Those are our three main that we're beginning. It's much broader than that, but I know that's what we're focused on as our top three. And we'll have a better report out once these are completed. We are working with Conduent, and Ashley and her team have been incredibly helpful. It's been very busy. Looking forward to having everything completed May 15th. We're going to have a celebration. So really, it's very rewarding to hear, Libby, that we're going through this, like the heart, that we're seeing so much alignment in the data and also the strategies. So anything that we can do to pull together in that collaborative work, and not one person or one organization doing something, but we're all doing it together, and maybe even meeting together with some specific goals and metrics is terrific. So I thank you so very kindly for the time.
Thank you so much, Elizabeth. We appreciate the update for the Cleveland Clinic. And moving through our list, I don't think we had a Medina County update, but if there is anybody on Medina from the Medina County area that would like to provide that update, please let us know in the chat. And for Ashtabula County, Jen, I know you're on. Are you able to speak very briefly about some of those Ashtabula County updates? And I think I may have seen an email come through just before we started our event this morning. So I want to make sure I give you an opportunity as well for Ashtabula.
Yeah, thank you. Yeah, I mean, we are really just freshly done with our meeting last night, and then I was still wrapping things up this morning. We had our implementation meeting last night, and it went really well. Our strategic priorities are, it was initially adult depression and anxiety, and then it went to throughout the lifespan depression and anxiety treatment and prevention, and then obesity and access to care. So those three issues. So what I did was develop an implementation register for each priority. So we had about 32 people at the meeting last night, broken into 3 groups, priority groups, with their own worksheet or register that went through the priorities and broken down into the different areas that we had determined needed to be worked on based on the chip. And then they discussed and wrote down, how we're going to approach these things. And we decided that I would send out a quarterly report to them electronically, and then they would fill it in based on their own meetings, the 3 groups separately. So I would send them out something quarterly. They would report their meetings back to me, and we would determine whether we would need to meet as a full group again. And I would do a newsletter based on that, and we would kind of breed whether we needed to meet more or less, or how that would work. And then I would have, the information at all, collected and gathered, so I could report, to you guys, and I could monitor the progress. So that's where we're at right now.
That's great. Thank you so much, Jen. And thank you for allowing me to put you on the spot there.
Oh,
Appreciate
that's
it.
no problem.
And then I think lastly, we would love to hear an update if there's a Portage County update. I believe their needs assessment was completed, and I don't know if we have anybody from Portage on right now, but again, if anybody is interested, please feel free to add something to the chat, and we're happy to hear from you about that as well. But we also want to just take a moment and open it up to any additional partners who are on the call. Of course, we have many hospital partners, health department partners who are here with us, but if there are other community health assessments or other projects such as those that are occurring that we might not be aware of, we'd love to hear any updates or any information about any of those local needs assessments. So we certainly invite any updates on those as well.
This is Catherine from Mercy Health. I just wanted to share. I wish we could have had this a couple of months ago because we just finished our chip, and I just think it helps you, just as you had said from the clinic, it really helps you say, oh my gosh, we're all on the same page, first and foremost, that the needs are same, and how can we come together to work on these? And one thing that we are continuing to see in that in our interviews that we had with our key strategic holders were around bias, and the fact that there is still bias that takes place, and how can we provide more education, especially for our healthcare providers, to not be judgmental and to remove that bias in care that happens. And so for me, hearing that was really eye-opening to say, what sort of education are we providing to make sure that that is eradicated? Obviously, we can't totally get rid of it, but the more we can raise awareness to people's internal biases that are there, it just does impact healthcare, and we've got to nip that. And then finally, just want to share, I'm just so grateful for Lorain County Public Health. I know Andrea's on here. That partnership that we have with a strong public health entity is so critical. And all my other partners with Bon Secours Mercy Health, our mother hospital, they're so jealous of the partnership that we have. So when you have a strong county public health, the difference it can make, and how I just feel like we're all on the same page. Like Andrew said, we're all working together. And I think that's what we have to do. We can't work in silos. We just have to come together and work. So that's it for me.
Thanks so much, Catherine, and appreciate the words too about that cross-sector engagement and collaboration. I think that's always really validating and reassuring to hear. So we're excited to hear about how that is occurring within many of our regional counties. So thanks so much. Okay, I'll give it another moment if there are any other updates. And again, if there are updates that you'd prefer to leave in the chat, we certainly invite that as well.
Libby, can we go back to my slide for just a second? I realized I didn't go over the maps that I put on there.
And apologies if they're a little small, David. That's on me.
It's okay. So looking at some of the data that we had, we found that there were consistent trends in specific areas. So looking at location matters, we found that a lot of the social vulnerability index from the CDC kind of matches up with issues that we're seeing in higher concentrations within our community for a lot of different things. So poverty kind of follows the same track as social vulnerability index, which is one of the factors that is used, so that makes sense. Life expectancy, premature birth, overdose deaths also follow that same track. Fast food purchases, COVID density, which is the light blue map in the middle there. But then also, if we look at all these maps, the other maps besides the social vulnerability index and the COVID density maps, those represent areas in Summit County that were traditionally redlined and historically redlined. And so if we look at those areas and we look at the same areas that are in the darker colors on our map, they all seem to line up. So there is that historical basis of the community not being invested in, the community having these issues that need to be addressed that stem back from, you know, a century's worth of just disenfranchisement. So we need to put more effort into those areas and recognize that that's a target that we need to look at. And so we are going to be focusing more on some specific campaigns, on some specific targeting in those communities, in those areas for moving forward.
That's great, David. Thanks so much. And I did see, Ashley, you left a comment about, and I just wanted to make sure I addressed this, that Portage did wrap up their chip too. So appreciate that update for Portage County as well. So I really appreciate everybody's updates, and especially for those of you who are sharing those updates and coming off of mute and everything like that. We appreciate your time and the attention that you're spending to give the updates to everybody else in our group here. But the overwhelming sense that I'm getting is just that there's so much great work that's going on. It's really great to hear, as a couple of you have mentioned too, that this work isn't siloed, that there is a lot that we're seeing pretty consistently across our region. So again, just thank you so much for providing those updates for us, but more importantly, thank you for being the ones doing the work too, because we know that you're working very tirelessly in these areas. So with that, we are going to move into our guest presentation. We are joined today by Ashley Wendt, Director of Consulting Services at Conduit and Healthy Communities Institute. And in preparation for this event, we had some conversations with Ashley. We do know that some of you have worked with Ashley through your own CHNA efforts, but we also realize that Conduit, with their national footprint, may be seeing some trends or observations that they have nationally and how those might compare to our region too. So we welcome you this morning, Ashley, and invite you to take it away. I'll go ahead and stop sharing, and the floor is yours.
Thanks, Libby, and thanks, Sarah, and thanks to all of you for allowing me to come and speak to you a little bit this morning. It's good to see some familiar faces from those of you in the counties that we've been able to work with over the past year and a half. And I think what I'm going to walk through today is not going to be really kind of shocking to you guys. I think more of affirming of many of the things that you guys have presented and talked about this morning, that, you know, we're starting to see these trends really come clearly across our individual communities at the county level, across the region, and things that we're seeing with our clients across the country: impact of COVID, exacerbation of some of these health needs that we've been looking at and working toward addressing in these needs assessments in our planning strategies for, you know, more than a decade now. So with that, I'm going to share my screen. And I'll say, as we're going through, please feel free to raise, speak up and ask a question. We'll definitely have time at the end to answer questions. Just in screen sharing mode, I can't see when you raise your hand. So if someone raised their hand, Libby or Sarah, let me know, or there's something in the chat. Once I stop sharing my screen, then we can address those. Let me get this up. Just a confirmation, verbal please, that you can see my slide deck.
I'm currently seeing your Teams screen, Ashley. I'm not seeing your slide deck quite yet.
Oh, goodness. Okay, let me start it again. Every time I open Teams, it's a new way to share my screen, and I never get it right.
No problem. And I know I had some technical difficulties earlier with my own PowerPoint. So all of the navigatable issues with technology that I know we're all very used to.
Okay. Do we have it now?
Yes.
Perfect. Okay, I'm going to make it full screen. So my name is Ashley Wendt. I am the Director of Public Health Consulting with Conduit Healthy Communities Institute. You've heard our organization mentioned a couple of times this morning. We've been working in the region initially with Libby and Sarah through this Healthy Northeast Ohio data platform for a number of years now. And I know some of you have been a part of this process since the beginning, and some counties are newer to this kind of joint convening of health and looking at health and centering data in your processes. So again, it's exciting to be in front of you this morning. We have a number of communities across the country that have platforms similar to you. They may be hosted by collaboratives or community-based organizations, hospitals, health departments, but everyone kind of coming together with similar goals and objectives. And the other half of the work that we do is supporting collaboratives, health departments, nonprofit hospital systems to work through their needs assessment and community planning processes. And so as many of you have mentioned this morning, we've been very lucky, and I've really had a great time working with many of you over the past year and a half as we've gone through this assessment and planning process together. So the goal today is really just to highlight some of the key findings, some of the trends that we're seeing across your region, and then taking it to a national lens too. And again, I don't think anything is going to be earth-shattering, but hopefully we're going to be able to talk about some things that you may be able to think about and implement for those of you that are still working on your implementation strategies or your CHIPs. And even as you may already be thinking ahead or not to your next assessment cycle. I know in Ohio, you guys are unique in that the state requires you guys to work together collaboratively. That's not the case in many states. So I think you guys are actually ahead of the curve for where we are seeing some of that national trend moving, and that more folks, community-based organizations, hospitals, health departments are beginning to work together more collectively on these assessments and really coalescing around how they can better improve their community's health. So with that, I'm going to go ahead and move forward. Again, I already mentioned that we help support the Healthy Northeast Ohio platform, which is one of the pieces that brings you guys together this morning. We worked with a majority of the counties, either directly or indirectly, again, over the last year and a half through these assessment processes. We've worked with Ashland, Cuyahoga, Geauga, Lake, and Portage County directly on their community health needs assessment processes. Some we supported the entire process from planning and data collection, analysis, prioritization, report writing, and some, in the case of Lake County, for example, as they shared this morning, they had done a lot of the data collection already for themselves, and we stepped in toward the end of their process and helped with data synthesis, analysis, and report writing. And then we're supporting CHIP development in Ashland, Cuyahoga, Geauga, and Portage County. I don't think we have anyone from Portage on today, but we just wrapped their CHIP assessment process back in January, and it was a really great process to move forward through with the health department there, and University Hospital is a big partner in that county, as well as many of your other counties. And then the mental health board there is another really big partner addressing behavioral health in Portage County. And indirectly, through our work with Cleveland Clinic, as Elizabeth mentioned, we are indirectly touching the assessment process through Cleveland Clinic in Lorain, Medina, and Summit County. So really Ashtabula for us is an outlier this cycle. But again, my goal for today is just to talk a little bit about the trends that we're seeing across the board, across these counties, and hopefully some of the takeaways for where there are opportunities to collaborate moving forward. As many of you know, and I'm going to touch on this at a high level, just for those of you that may not be as intimately involved and aware of these health assessment cycle processes and cycles. The Affordable Care Act requires our nonprofit hospitals across the country to implement community health needs assessment processes and develop implementation strategies every 3 years. And then in addition to that, we have our health departments that are primarily wanting to get their FAB accreditation or going forward for reaccreditation. And some, even if they're not working toward accreditation, they see the benefit in implementing some type of assessment and planning cycle. And that's typically done on a 5-year cycle. And again, I think Ohio is unique in that your state is asking you to work together and doing that more frequently on that 3-year cycle to ensure the nonprofit hospitals are able to meet their IRS requirements. And so with that, you guys have that extra layer of ensuring that at least some, if not all, of the priorities that you're looking at from the community level and the work plans that you're putting together are in alignment in some way with the state health assessment and the findings from that state health assessment, as well as the state health improvement plan. And we're going to talk a little bit about some of the challenges with that a little bit later in the presentation. And again, this is just an overview of what that cycle typically looks like. Planning and organizing, collecting that data. We typically use secondary data. In your case, there's a wealth of secondary data from national, state, local sources on your Healthy Northeast Ohio site. Complementing that with community feedback. That could be community surveys, qualitative data, such as focus groups, community listening sessions, key informant interviews, and then really synthesizing and bringing that data together so we can understand what health needs are trending in our community and where there's opportunity for us to make an impact and move the needle to address community health, to address some of those barriers, social determinants of health that we are seeing cycle over cycle. And then moving from that, what I think is the most important part is taking those findings and moving into action, coming together collectively, understanding where there is synergy to work together on behavioral health, for example, or on access to health, and then planning what that's going to look like, how community-based organizations can support the process, what support the hospitals and the communities can provide, and then the health department through their CHNA and CHIP process really being the backbone of a lot of that as well. I mentioned the state health improvement plan. So this is the current based from 2020 to 2022 state health improvement plan framework. We are waiting with bated breath for the newest iteration of the state health improvement plan for the state of Ohio to come out. But the main points to take away here, and again, we're going to see a lot of these trending as we talk about what we're seeing across the region and across the country, these areas under health and well-being, community conditions, health behaviors, access to care, and then looking at specific areas like mental health and addiction, so those behavioral health areas, chronic disease, and then maternal and infant health. We have a few frameworks that we approach our work with, and if you've been one of the groups that have worked with us, you've seen these before, but we have adopted our version of this health equity framework from the Bay Area Regional Health Inequities Initiative. And I really like this visual because it allows us to think about the social determinants of health and health equity and really illustrating these upstream and downstream factors. And I'm going to go into this a little bit more later, but in public health, we've been talking about health, social determinants of health for a number of years now. And I think we're seeing it come more into the national conversation finally because of the impact of COVID and the disproportionate impact that we saw in our Black and Brown communities with COVID impact. But we're also seeing more communities and more standards across the country really centering health equity. So there's kind of a shift from talking about the social determinants of health to really trying to explore health equity in a broader sense of the term, thinking about root causes that influence social determinants of health, which influence health outcomes, and even building in additional nuances such as systemic racism. And I know some of your communities are really centering those conversations, and we're seeing that reflected in the new MAP 2.0 that some of you may be familiar with, if you're using MAP as a guide for your assessment processes, we're seeing health equity centered in a lot of the new frameworks coming out, like the FAB 2022 standards. So health equity is here to stay. And I think as we continue to talk about this, there will be more nuances built in. I had an interesting question come up when we were doing an in-person CHIP session in Portage County, actually. And, you know, they had social determinants of health centered in their previous process and were very intentional for putting health equity in up front in their process for this new CHIP. And a community member raised their hand and said, you know, are we just not thinking about or talking about social determinants of health anymore because we're shifting to this health equity? And my response to them was, we have to think about this as more of a spectrum. So, you know, root causes filter into social determinants of health, which filter into health equity. And again, then all those nuances in between as we think about, you know, root causes related to, you know, systemic inequities, institutional racism, things like that. So I encourage you, when you're talking about these topics and thinking about these topics, to kind of visualize that as more of a spectrum and how they really are all integrated and play into one another. And with that, again, another visual that you may be familiar with, but as we're thinking about how we may look at opportunities for integrating health equity into our strategy plans, our CHIPs, our implementation strategies, just remembering that health equity means a blanket program or activity may not have the intention that we are ideally wanting. So if we can understand more specifically, you know, which populations are being impacted by a particular health concern, if a particular population is more vulnerable, then we can curate the focus and intention of those programs. Maybe it's looking at it geographically. A lot of you have brought up maps in your presentation. We've talked a little bit about the socio needs index today, and I'm going to use a few examples in a little bit of how we can use that to focus down some of our programming. But again, just another way for us to think about how we can leverage health equity to focus the impact of the programs and activities and funding that we're building into these work strategies. So this is a summary, and again, this is a summary from our perspective at Conduit HCI, because these are the clients that we've worked directly with over the past year and a half. I would love for, you know, Libby and Sarah to work with you guys to build in the additional counties for their prioritized health needs, so we can truly see this as a matrix for the whole Healthy Northeast Ohio. So I'm happy to work with you guys to do that afterwards. But even with just the few that we've highlighted here, we already see some trends across the board, and many of you spoke to that already today. Access to healthcare in some way, shape, or form is coming up across the board for all the groups that we worked with this past cycle: Ashland County, Cuyahoga, Geauga, Lake Portage, and Cleveland Clinic. Behavioral health, so mental health and substance use or misuse, seeing that come up clearly across the board in all the counties. Cancer coming up for Ashland County. We see chronic disease and prevention management coming up to the top as a prioritized health need for Geauga, Lake Portage, and Cleveland Clinic. Maternal and child health coming up to the top as a identified prioritized health need for Portage County and Cleveland Clinic. And then the maternal and child health kind of population was identified as a priority population by Cuyahoga County through their process, and that will be built throughout their implementation or their CHIP. Social determinants of health or community conditions are coming up pretty frequently across the board, and some groups choose to have an overarching theme of social determinants of health that we want to address, you know, transportation and access across the board, for example. And then some communities have specific focus within the social determinants of health and community conditions. So we see Cleveland Clinic having social determinants of health, and Elizabeth mentioned some of the specific areas that they're focusing on. Portage County had that as an overarching theme for their CHIP, for their assessment and their CHIP. And then Cuyahoga County, for example, is specifically looking at access to healthy food and community safety in relation to social determinants of health. The next slide, again, is just kind of an overarching comparison looking at some additional considerations that folks have built or intentions that they've built into their assessments and planning for their CHIPs. Again, Cuyahoga County, some priority populations for them, maternal, fetal, and infant health, as well as older adults. Some overarching or cross-cutting focal areas, Cuyahoga County centering eliminating structural racism, and that is building on some historical work that they've done in that county, and then continuing focusing on enhancing trust and trustworthiness. Bias was brought up earlier, and we're going to talk a little bit about cultural competency in care in a minute, and all of that really comes together in relation to that trust building and trustworthiness within our clinical care system, within our provider community. For Portage County, healthcare access, social determinants of health, and health equity came to the top. And again, I just mentioned that conversation that we had during their CHIP planning about, how we transition from talking about social determinants of health to really centering equity in the conversation, and how that is then built into our CHIP planning. Cleveland Clinic, as Elizabeth mentioned, health equity and addressing social determinants of health. And they also have that additional focus as the clinic for medical research and professional education. And then a unique piece, and a lot of our groups that we've worked with have some type of geographical focus within their CHIP, for example, and we'll talk about a few of those examples in a little bit. But I think Lake County was unique this cycle from a lot of clients that I work with, not just in Ohio, in that they really wanted to focus on 7 specific census tracts within the county, not just zip codes. These were census tracts that were showing up looking at the Health Equity Index, and these were also some similar census tracts where they had focused some outreach during the height of the COVID-19 pandemic. And so that focus is allowing them to center some of the outreach and planning that they're building into their CHIP and implementation strategies. So a lot of information, but again, the goal there was just to show you how some of these key topic areas are trending in some way, shape, or form across the region. And I'll tell you now, these are not dissimilar to the trends that we're seeing across the country, and we'll talk about that next, actually. So I did want to provide, again, kind of a regional perspective, again, from the counties that we've worked with the past year and a half. So there's a few exceptions for those of you guys that we haven't worked directly with. But again, from the conversations and presentations that you've done this morning, I don't think any of these will be, anything different than you've seen in your communities. So some overall trends, again, culturally competent care. Bias was brought up earlier, so our opportunity to address some of the things that are still keeping community members or certain groups within our communities from accessing care. A lot of things are shared by mouth within communities, and if you have one negative experience, you may go and share with your friends and family that I went to so-and-so location and really didn't have a good experience, and so that can be a challenge that you as a provider then have to work to overcome. So thinking about how we can address providing more culturally competent care, addressing biases, so that may look like training, that may look like diversification in hiring, ensuring that we understand what languages are most often utilized outside of English in our care settings and within the community, so that we're able to better provide that culturally relevant care. In addition to that is addressing health literacy and knowledge gaps, especially in relation to access to care. It runs from, folks, the services may be there, the resources may be there, and the community may just not know about them or understand how to access them. So there is a portion there around health literacy and knowledge gaps. And the other is just allowing people to understand how they can successfully navigate a health system. If you are an individual or a community that has historically accessed care through the ER, and you are able to finally get some type of healthcare coverage, your reality looks a lot different, having to make an appointment, perhaps, maybe having a wait. And so that process looks a lot different than, just being able to show up to the ER and waiting, and being able to see a provider that way. And I think that plays in to a lot of the primary care and prevention conversations we see as well. Especially the next point, seeking care, especially specialty care outside the county, particularly in a lot of our counties outside Cuyahoga, outside Cleveland proper, seeing the need to travel further if you're in a rural part of the county to access any type of care. And then also if it's some type of specialty care, maybe your referral is in an adjoining county. And so, just again, the need to navigate that, to arrange transportation, can build into barriers to be able to access that health care that an individual may need. And then general barriers, again, that these probably aren't surprising to you. Cost and transportation continue to be two of the largest barriers towards access to care. Uninsured and underinsured. We saw a shift in insurance during the pandemic and with changes in the economy. The majority of individuals in the country have their health insurance tied to their employer. And if you lose work or you're shifting to employment that doesn't provide those types of benefits, it really impacts the ability to have insurance and to be able to leverage that to get care for yourself and your family. And also, we know that just because you have insurance doesn't mean that you're able to afford to access the care that you need. So being underinsured can be just as challenging sometimes as being uninsured. And I wanted to, I've tried to refer back to the Healthy NEO site for how you may want to think about integrating some of the data and mapping and functionality in the site into your processes. So here are just an example of some of the Healthy NEO secondary data indicators that could be relevant when we're considering access to healthcare. Looking at provider rates, primary care, mental health, adults who have a routine checkup, adults with health insurance, children with health insurance, and then dental access as well. Oral care is, something that doesn't necessarily always come up to the top, but when we're thinking about access to these other types of healthcare is something that we can think about. Dental care, oral care, especially among the pediatric population, can be important to think about. I wanted to give a little bit of plug for a few of our indices. So this is the Health Equity Index. We've seen a little bit of this morning, and this is our older index, our oldest index, our first index that we had on our site. For those of you not familiar, it's a composite value of 6 different social determinants of health that are associated with those poor health outcomes. And it really allows us to look at a regional, a county, a zip code, or even that census tract level to understand where there are impacts for disproportionate health outcomes. And I'm going to show a few examples here. So first up is just, I downloaded this this week. This is a regional snapshot from the Health Equity Index. Color is important with these indices. So the darker colors indicate areas of potential higher impact, or as I like to say, areas of opportunity. So if we're trying to focus work and funding and collaboration at a regional level, for example, these areas of darker blue are indications of areas where we have the potential to make larger impact in relation to health outcomes. This is an example of from Ashland County. This was the Health Equity Index that we built into their assessment process this time. So we're looking at the county as a whole, but within that, the different zip codes. And here we see, one outlier at the top there with the darker blue. But if we're able to dive in a little bit more looking at the census tract level. And so looking at this one particular zip code consisting of a number of census tracts, and we see right there in the middle is our darkest blue, and that's actually Ashland proper within the county. And so again, depending on the level that you're interested in looking at, for me, looking at these types of mapping, whether it's the ones through the Healthy NEO site or some of the other maps that were shown today, it's really an opportunity for us to think about where we may be able to have impact, not only identifying key populations or key health issues or social determinants of health, but if we're able to, where we can potentially target these interventions and work to make the biggest impact. The next one that I wanted to present is the behavioral health, because that was the other area that trended to the top across all the groups that we were looking at over the past year and a half. So again, overall trends, and I'm sure everyone has seen this, we've seen this across the country, the impact of COVID-19 on mental health, especially among populations who are already socially isolated or vulnerable, thinking about our older adults, that 65 and older population who were even more separated from their families and their communities during the COVID-19 pandemic, when we were going through social isolation recommendations, thinking about the pediatric population, that 18 and under population, all the changes that they were having to go through during the pandemic, being in school and out of school, parents working from home and not working from home. So just a lot of changes, being able to be around friends or not. So really seeing a disproportionate impact on those two groups. We saw this among the LGBTQ community as well, in Cuyahoga County, for example. Again, a population that can already be somewhat socially isolated, and these types of impacts, like the pandemic, can kind of double down on the mental health challenges they may be struggling with. Also saw an increase in drug and alcohol use during and post-pandemic, as people were turning to these substances to address and self-medicate for some of these mental health issues that we're seeing. Provider shortages, and I know this is can vary across the board, but across the country and across your counties in the Healthy Northeast Ohio region, we heard and saw provider shortages being a challenge, particularly for behavioral health, both in shifting in personnel or not having sufficient personnel that are certified to be able to provide the level of care that we're needing, as we're seeing an increase in individuals that are trying to access these services. And we'll talk a little bit more about that in a moment. Stigma still exists. Stigma to talk about issues that you may be having with drugs or alcohol, or depression among your peers, with your family, and stigma for seeking treatment and care for behavioral health still exists, and something that I think we have to think creatively about as we're working on education and outreach around these behavioral health interventions. And then similar barriers, as we saw, to access to care, barriers including cost, transportation, and that provider access. And access, one thing I failed to mention is, and thinking about kind of culturally or community competent related care, thinking about the expansion of the hours that we're offering care. I know that's not a new thought, but not necessarily only offering that care Monday through Friday, 9 to 5, being able to offer a variety of services at a different time to be able to capture those populations that may not be able to take the time away from their work to be able to access those services, or bring their children in or their family in for those services. Some healthy NEO indicator examples here that I wanted to highlight: depression among the Medicare population, poor mental health days, age-adjusted death rate due to suicide, and then we have some of the drug and alcohol indicators here, such as e-cigarette use and binge drinking. I wanted to provide a specific indicator example of how you can look at this on the Healthy NEO site. This is the age-adjusted death rate due to suicide indicator for Portage County. So we're able to see a trend up across time since 2011 to 2020. And the other cool thing I think that's offered on the site, you can also see how your county is doing on particular indicators compared to the other counties in the Healthy NEO region. So for example, here, when we're looking at this indicator, Portage County is second highest among the 9 counties in the Northeast Ohio area, second to Ashtabula County. One of the other indices that we have is our mental health index. This really came out right around COVID as well. And again, this is a compilation of indicators that are shown to allow us to look at where disparities in mental health outcomes exist. And so as we looked at earlier, darker purple here for the mental health index are going to indicate areas where there are disproportionate outcomes related to mental health. And again, as I like to look at it, areas of opportunity for us to focus our work and efforts. Looking at a more specific example, this is from the Cuyahoga County assessment process. So we're looking at all the zip codes within Cuyahoga County, and we see, the core purple area there, down the lake and then out into 44146, and a number of zip codes scoring 100 on the index, meaning, compared to other zip codes within Cuyahoga County and similar zip codes to communities across the country, there is a higher need related to mental health outcomes in those zip codes. So finally, wrapping up before I pop out to questions, and again, we've talked about a lot of these already, but I wanted to come back and just kind of center these as I'm closing out the presentation. But some national trends that we're seeing, and they're relevant for the region as well. Again, continued conversation and focus on health equity and social determinants of health. We saw an increase across the board that food insecurity and housing insecurity were coming up. And I think that is that exacerbation that we're seeing because of COVID-19. I mentioned here, we're seeing that increase in the ALICE population across the board. That's our asset limited, income constrained, but employed population. And as we're seeing an increase in those individuals and families trying to access these services, it's putting additional burden on community-based organizations that may be providing support to address these needs related to food insecurity, for example, or related to housing insecurity. So if these are topic areas that were coming up for you in your assessment, I think there's opportunity for collaboration, and I know many of you are already thinking about and doing that in relation to how can we collaborate on food insecurity inside our clinical walls and outside. It may be screenings, it may be connecting to services and referrals, but there's a lot of opportunity out there for us to work together to address some of these more challenging social determinants of health. Transportation, again, across the board, particularly in relation to access to services, continues to be a problem, particularly in our rural areas and more rural counties. We've already mentioned the impact of COVID-19 and the exacerbation of many of the health needs that we have historically seen come across our assessment results. So across the board, since 2019, we really haven't seen many changes in the prioritized health needs. Again, we're just seeing a greater impact of those health areas. But the things that we are seeing is an increase in the social determinants of health coming through, particularly in the community feedback or qualitative community feedback. And those are related back to that food insecurity, housing insecurity, mental health needs. I mentioned Ohio's unique in that the state mandates that you work together to do these assessments now between our nonprofit hospitals and our health departments. But nationally, we are seeing a trend that more and more groups are beginning to work together and seeing the benefit of doing these assessments as a collaborative approach. And that requires planning. Again, we mentioned at the top that our hospitals typically do this on a 3-year cycle, and our health departments are typically doing this on a 5-year cycle. So there has to be some negotiation one way or the other to ensure that we can collaboratively work together on an assessment together, and then how we can in a cyclical and ongoing process, continue to meet the needs for the individuals that are kind of off cycle. And again, more emphasis and importance put on community input and feedback. And I'm going to talk a little bit about MAP 2.0 in a minute. Some of the changes that we're seeing with the FAB accreditation coming out of 2022, again, is pushing more centering of community input and community feedback in complement to the secondary data that we've historically used. Some specific challenges, again, some are specific to the work that we saw in your region and again, are relevant across the board as well. You know, one thing that was challenging this time, especially as we were finalizing the assessments and moving into the CHIP planning for the counties, is that we're still waiting on the finalization and release of the latest updated Ohio SHIP. And so you guys are being asked to show alignment with those strategies, but you guys are looking at outcomes and strategies from 2022 and kind of trying to overlay that retroactively on the outcomes of the 2019 SHA from the state of Ohio. So there's been some conversation of how that works. And so one thing that I would hope in the future that that state level assessment will be more in alignment with the majority of the counties in the state that are going through your cycle, so that you guys can link up that connection and an intention between the two processes. We've mentioned staffing changes and staffing shortages in relation to access, but this has also impacted you know, the ability for you guys to do your work. These assessments are work that you take on in addition to other things that are important in your community. You know, one thing that we haven't acknowledged is that, you know, COVID really forced us to put our plans on the shelf. You know, a lot of you are finishing your assessments in 2019, last time moving into 2020, kind of ready to take on your CHIPs. And you had to shift your focus to COVID. And so moving into this new assessment, updating your CHIP, you know, it required us to pull that old CHIP off the shelf, see what was still relevant, and kind of shift focus. And I think we always kind of have that in the back of our mind that, you know, we have, you know, our best efforts into these CHIPs and what we want to take on and the work that we want to do together. But, you know, there's always something that can come along that forces us to shift our focus, you know, short term or long term. And staffing changes is a part of that. Across the board with health departments, we're seeing a lot of new staff come on to health departments that may not have been a part of these assessments before. Same with hospitals. They may be new to the community health needs assessment processes. So there's more education opportunity. There's more guidance needed for those groups just because it's a new process. And I think that can be stressful when, you know, a new person is coming into a health department, for example, and being tasked with taking on your FAB reaccreditation, and you may not have ever heard of FAB, and you may not have ever taken on something as complex as a community health assessment. And so, you know, that can leave you with a really steep learning curve going into these processes. And I've also seen that it's impacted our collaborations, where we may have had, you know, really strong collaborations historically, just because we have staffing changes. You know, that may mean that we need to rebuild some of those foundational relationships that are crucial to us being able to come together in these processes and work together. And conversely, I think COVID really pushed a lot of communities to work together more concretely than they may have before. I don't think that was necessarily the case in Ohio, but I think there's a lot of momentum that can be taken advantage of for how, you know, local government, for example, was working with health departments and hospitals to address, you know, the ever-changing challenges with COVID, and taking that momentum and moving it forward to continue that collaboration and build that into these assessment processes. And just recognizing that, again, collaboration can be challenging no matter how long we've worked together, because there's all these outside factors that can influence the process and influence our ability to really focus and be able to contribute to these collaborative processes. And my last piece here is just things to consider. I want to be cognizant of our time and make sure we have a few minutes for questions. But some things I've already talked about, opportunity to consider geographical focal areas. Again, identifying the who, the what, but also the where there's opportunity for us to potentially geographically target our programs and activities in our CHIPs. I show the example of Lake County using the Health Equity Index to target those 7 census tracts, but Portage County also used the Socio Needs Index to target some of their programming for their CHIP, particularly in the areas of behavioral health and food insecurity. And they had specific sets of zip codes within their county that they're wanting to focus on to address food insecurity, for example. Some unique data collection opportunities. Again, Portage County, I think, was an outlier in that they replicate a YRBS for their county. They really want to be able to speak to and understand the health needs related to the youth population in the county. The state level YRBS wasn't really reflective of or inclusive of the amount of information they wanted for Portage County. So they've been doing this for a number of cycles now. And for counties that are interested in understanding more about a pediatric population, that youth population, I think Portage County could be an interesting model to look at for how they modified the YRBS to suit the county purposes, how they work with their local middle school and high school administrators to implement those surveys, and how they're building that into their assessment process. Again, opportunities for collaborative data collection and data sharing between entities, and even if we're starting to think more regionally across counties as well. And then again, looking at the power of that qualitative data to really center the voices and feedback of our community members, these harder to reach populations that may not be represented in that secondary data as much, and using our focus groups, key informants, or community listening sessions really thoughtfully to highlight those voices and bring those in for consideration into our assessments. And then finally, Sarah mentioned this earlier, and I'm going to highlight Geauga here for this one. I know this is one that they are interested in as they're wrapping up their CHIP. And my coworker's not on the call, but my coworker Era has been working with the wonderful folks over at Geauga County on their assessment and their CHIP process, but they're wanting to take advantage of the progress tracker and their sub-site on the Healthy NEO platform to build a tracker that will coincide with the work that they are taking on with their community health improvement plan. And I know that's something that Sarah and Libby are ready to think about strategically with you guys on an individual county level, or even a regional level when you're ready to be able to build that those types of trackers into the platform. I'll leave with just the comment that some of the things that we've talked about today, we're seeing them showing influence in some of these frameworks that a lot of health departments and collaboratives use to guide their assessment processes. Many of you have used MAP historically, either following MAP in a very strict, stringent process, or maybe a MAP light that you really think about some of the key components of the MAP process. This is what MAP 2.0 is really going to look like. They're piloting MAP 2.0 now. I know NACHO is hoping to kind of officially launch MAP 2.0 this summer at their NACHO conference. And again, here we see reflected a lot of the components that we have historically built into our assessments, but there's some nuances and a shift from some of the things that we've historically seen in the old MAP process. But we're still seeing, a community status assessment, our ability to highlight that secondary data, our community context, hearing from the community themselves, getting some of that qualitative data, those community voices, and then really highlighting the work from our community partners, because we know, our community partners are key, not only for the assessment process, but as we move into how we are going to actually build our CHIP and come together and work on these things. But we're also seeing, here in the inside of our Venn diagram, those health inequities, those root causes, those social determinants of health. So a lot of the things that we've talked about already today, a lot of things that many of you are already integrating into your assessment processes are reflective of some of these updates that they've made to the MAP 2.0 process. So I've talked at you a lot. I'm going to stop sharing my screen and come back out to see if there are any questions or comments, particularly from those that, you know, I may have talked about some of your work. If you want to clarify or say you actually got it wrong, Ashley, this is what it's actually said, or for those of you that I didn't highlight in our process because we didn't have the opportunity to work with you this time, I would love for you guys to be able to share any kind of complimentary information or findings or feedback that you saw in your own assessment or CHIP processes.
And thanks, Ashley. While people are thinking over any questions that they might have for you, I know we just have a couple of minutes, so please do feel free to add those. I'm checking the chat right now. I know we had a couple of great pieces of feedback from some of our partners. So thanks to Vicki, Catherine, Jen, I saw earlier, I think it was one of the first slides you had displayed, Ashley. That seemed to be, participants seemed to like that as well. And so, yeah, we just want to make sure we give Ashley an opportunity to answer any questions that anybody has before we move into our conclusion. And I know we'll wrap up right around 10:30, so we want to be cognizant of everybody's time.
I would like to make a comment. We're really excited to be working with you guys on the progress tracker, and hopefully this will help the community as well to be more open with them and they can see our progress. So that's something my coworker Sarah, she couldn't be here, but she's the lead for that and she's really excited for this. And Era has been wonderful, and we just want to pass that on to you as well, Ashley. So thank you.
She loves you guys and speaks very highly of you and your process as well. So the feeling's mutual.
Thanks so much, Magali. I know Sarah and I are very excited to pilot that too with Giaga. So for everybody else, more to come on that. We're excited to be able to have that for you all to preview and hopefully the coming weeks and months. Any other questions for Ashley before we wrap up? I'll go ahead and reshare my screen, but please do feel free to add those to the chat, or Ashley, I think we can include your contact information too when we send our follow-up. So if there are any outstanding questions that come up, we can certainly send those your way as well.
Yeah, I just put my email in the chat. Yeah, feel free to reach out. Again, a lot of these lovely folks that we've been able to work with. I appreciate Vicki's love for data. She's a data nerd like me, and I know she really loved diving into the data from the platform. So a lot of good ideas, a lot of great things going on in these counties, and I think there's a lot of opportunity for you guys to learn and build off one another's progress and innovative ideas. So that's what is exciting for me to see.
Thank you, Ashley, and thanks again for your time this morning. And we are going to just move in to a couple of wrap up and conclusion slides. So again, I know we just have about 2 minutes, so we're gonna be brief with our wrapping up updates. But if there is anything you'd like to hear about during our next regional convening, we've been having about 2 of these a year. And Catherine, I know you mentioned even earlier, you know, maybe more would be helpful. So any feedback you have either about guest speakers, any general feedback about the layout and agenda of these events, we really want to make it valuable to your time, and we know that you are all very busy, so please do feel free to either add those to the chat, or you can also feel free to provide us that feedback through email. We really value feedback, and we, like I said, want to make sure that these opportunities are valuable for all of you. So that is just our call to action and our kind request for all of our partners that are on today. And just a couple of items that we'd like to share before we completely wrap up. I think many of you might already be aware of this, but the Ohio Department of Health has their state health assessment survey that's currently open to stakeholders and organizations. I believe it's open through tomorrow. I'm going to add that link to the chat. Many of you have probably already seen this. Many of you have perhaps already completed this, but in the chance that there's anybody on the call who hasn't, we wanted to make sure we shared that information. And I think that blends nicely with some of the conversations we've been having today too. A reminder, whenever you do have any updated reports related to your needs assessments or other general community health resources, please do let us know, and we're happy to add those either to our resource library. We have our 9 county specific web pages too that we keep updated, so we'd love to feature any of your reports, and again, any resources that would be valuable to not only our partners that are on the call today, but all of our site users. And then lastly, you can always connect with our team via email or through the Contact Us page of our website. In the coming weeks, we do encourage you to contact Sarah Szabo directly, and here you have her email address, as we'll have some staff changes. I'll be unavailable due to a scheduled leave of absence. So we do encourage you to contact Sarah directly for those Healthy Northeast Ohio questions or requests. And Sarah, anything else that you would like to share before we sign off? I know we're right at the 10:30 mark.
My dog is being loud in the background, so apologies. No, just thanks everyone for joining us. I'm seeing some comments about interest with the progress tracker. So again, please just reach out. We're really excited to get that going and work with you all. So thank you.
Thank you so much for your time, everyone, and we hope you have a great day. See you soon.